are now joining in on the live day, Usman, who is currently a medical student. Assalamu alaikum, Usman.
Wa alaikum assalam.
So we've got a mixed show today. We're going to, as always, cover a bit of careers in medicine. So I'd be very interested in Usman's journey. And also today we're going to talk a bit about vaccinations. So as a paediatrician, that's very close to my heart, and I know it's a very topical subject, especially in the community, with lots of misconceptions, but lots of very positive things as well. So Usman, tell us a bit about where you are in your career and how you got there.
Okay, Bismillah ar-Rahman ar-Rahim. First of all, thank you for inviting me on your show. Secondly, congratulations on becoming a consultant paediatrician.
Thank you.
So I've just finished actually my preclinical years. So I've just finished second year. So I'm at Keele University at the moment. But I've taken a path which is probably different to most people anyway. So I did my normal. I think I heard your show 2 weeks ago when you spoke about getting into medicine and stuff like that. So I did my normal A levels, chemistry, biology, the whole normal schedule. And actually at that time I got into medicine. But then my father passed away and I had other circumstances going on. So I thought, do you know what, it's not the best option right now. So I went off and I did a degree in biomedical sciences.
Okay.
At St. George's. 3 years I spent there, and that was great actually. It was nice to... thing is, like, I've always enjoyed science and biology. And I was like, I need to approach something that's along those lines. So I did biomedical sciences, and then I got a chance to do a master's at Imperial in biomedical research, because I enjoyed my research in biomedical sciences as well. So I did that for a year, and applied for medicine because I wanted to get into medicine at some point. And alhamdulillah, Keele is, well, for those people who don't know, it's near Stoke. It's
one of the new medical colleges, isn't it?
So it's not very old. It's probably about 10 years old.
Okay.
But last year it got voted the 3rd best medical school in the Guardian.
Wow.
So it's doing very, very well. And actually, I was genuinely surprised how good it was. So I've just finished second year, so I'm out of university for once. And inshallah, next year I'll be starting third year. So clinical hospital placements and all of that. It's been a long journey, but I'm there. Yeah.
So it's quite... So just to tell our audience, so in most medical courses, they're normally about a 5-year course.
Yes.
Some are 6 years. The 5-year course is a pure medical course normally. And the 6-year one, I did a 6-year one, but I also did a BSc in 1 year. That was at UCL. And I think Imperial have a similar 6-year course.
Imperial, and I think there was another university, I can't remember now, they were starting the 6th year, but they've also got 4 years as well. So for people who've done a degree, like for example myself, I was in a situation where I could have done a 4-year degree, but Keele don't do a 4-year degree, they only do a 5-year degree.
Okay.
So there's options for 4 years if you've done a degree, 5 years and 6 years. The benefit of having a BSc is actually quite good, because in later years, as you must have seen, it's quite beneficial to have another degree on your profile.
It's very few doctors will be just MBBS holders. Most will have a BSc and a master's. And when you reach a consultant level, most people actually have a PhD as well. So it's a lifelong learning. And I remember when I applied for medical school and I was getting really like, oh, should I do a 6-year course? Should I do a 5-year course? Oh, it's another year. I really shouldn't go to UCL. But seriously now, a long time, that was a long time ago. That was about 10 years ago. It really makes no difference whatsoever, because the medical profession is lifelong learning, and you will have to do add-on postgraduate courses, further degrees throughout your studies. You shouldn't be put off by that, because all of those will contribute towards your career. And actually most of them are not like sitting in a classroom, they're research or they're clinical degrees. So you're clinically working throughout those degrees. So don't panic. And if anyone's got questions about it, we're happy to answer. So just a reminder to anyone that wants to call into the studio, it's a live show. So if you want any career advice from Usman as a new medical student, or myself as a hospital physician at the moment, please do call into the studio. We're on 0333 011 6786. Just to remind you all, it's 0333 011 6786. So please do call if any career-rated questions you'd like, or any general medical questions that hopefully we can answer for you.
Just want to add another thing on that. A year, if you think about it, isn't that big on the grand scheme of things.
Yeah.
And like you mentioned, you're always going to be doing exams.
Exactly.
You're always going to be studying, and actually having that extra qualifications really helps you, especially if you want to then go out and compete for the top jobs. You really need those extra qualifications. And like, for example, I've already spent 4 or 5 years doing my undergrad and my masters as well. But to be fair, now that I look on it, it's easier for me to do medicine now than it would have been if I started from A levels.
Exactly. So postgraduates are they're always far ahead of the game. I remember in medical school, not obviously coming from A levels, that the postgraduates were way above the rest of us. So we didn't even know, how to pace ourselves, how to prepare for examinations, because you're not used to university life, and actually it's such a huge change coming from a school to university. So the postgrads are just way ahead of the game. No,
definitely, especially medicine as well. Medicine's not an easy degree. People think once we get in, it's all plain sailing, but actually it's not. Like the first 2-3 years are really, really hard trying to get into the scheme of things, and it's basically like a 9 to 9 job. It's a 12-hour job every single day when you have to go for the lectures and come back and work over it. And trying to get
don't stress everyone. It's not 9 to 9 every single day.
It's not every day. I mean, I do have weekends off here and there. No, it's not that bad actually. But what it does come down to, the fact is, like, I had an experience of going to university before, and like stuff they were talking about, at least the words made sense to me because of my previous degree. But for new school leavers, it can be a bit daunting.
Yes.
But the amazing thing is, medical schools in the UK are so amazingly organized, and the way that they slowly bring you into things is amazing. Like communication skills, for example, they start from first year, so I've already started talking to patients and stuff like that, and they slowly bring that into you. And now that I look upon it, the skills I've developed, it just comes so naturally to you because of the way medical schools in the UK teach that. And I think we have to give that to the medical schools here in the UK, how amazing they are at teaching.
So I would definitely say, it's an intensive journey. There's no question about it. But actually, you can have a very good work-life balance. I think it's fair to say I've probably have achieved that. So I don't think I've ever been so bogged down in my studies or to get to where I've got to, where I haven't had a good private life or social life. So you just have to know where to compromise, just with everything else in life. So, I would know if for a weekend I need to go to a family wedding, that week I would probably just study a little bit extra on the evenings, because then I'd free myself up for the whole weekend, and I wouldn't study that weekend. But similarly, if I wanted to have lighter evenings, I'd work. So it's all about pacing yourself, planning ahead, being prepared, and certainly towards exams, you will be a little bit more focusing on your work and your revision and your work on your studies and projects. But when you haven't got exam period, you might not be that intensive, and you might give more time to your family, to your friends, and to your personal things.
That's what I had this year. Like for the last 2 years, all I was doing was studying a bit more in the evening, and I had all my weekends off. I used to come back to London every weekend, spend with the family. It's a nice time to like relax, chill. It's a good refresh for the week ahead, and actually it gives you a nice perfect balance, because as a medical student you can't always be studying, because there's going to be a point where you're going to burn out. So you need that time away, you need that time to relax and refresh your mind and come back to it. And actually all of that builds up nicely for when you come closer to exams, because then you're nicely prepared and nicely fresh for revision and all that.
Exactly. And that goes without saying for many professions. I mean, well, obviously this is a medical show. We're both medics, so we're just focusing on medicine. But I've got many friends in other sectors, so legal world, in the accountancy world, finance world. And to be honest with you, at times, I certainly think that they work harder than I do. They're often in the office longer hours than I am. I'll be home and having dinner when they're still in their office. So by no means are we saying our profession is it's certainly probably not one of the most intensive kind of professions. I think any high profile profession you want to have. So if you do want to have a very academic profession, whether in the artistic world or in the scientific world, it goes without saying there's no such thing as having success without hard work. So whatever field you go into, you're going to have to put a lot of hard work into it.
I concur with that. Like my brother's doing accountancy and built mathematics on the side, and he's currently working, and I haven't seen him much for the last 3-4 days I've been home, just because like he's got exams going on, he's working as well. It's quite difficult. But then at the end of the day, we can clearly see people who've worked hard to reach the top. You can't get to the top if you don't work hard. And I think that we can all take a message from that, you know what, sitting at home and trying to just go to the lectures, come home and chill, you won't really get that far. To actually get far, you have to work hard, regardless of whether that's medicine, accountancy, lawyers, wherever they are. Whoever's working in the top positions right now, actually work really, really hard.
And also, inshallah, there's also some hope that from Allah we'll get some reward for this as well, because doing going through any kind of hardship to reach a good outcome, there's reward in that.
Definitely.
Not only is there reward in terms of, inshallah, getting blessings from Allah for it, but also it builds your character. So if you work hard, you can appreciate the finer things in life a bit more.
Yeah.
But also working hard makes you realize what the journey our prophets have gone through. And by no means am I trying to compare my hardships, no way. But what I'm trying to say is that by going through hardships in life, you definitely come out as a better character, as a better person, and therefore you're becoming a better Muslim.
Definitely.
So in everything we do, we try to think of our deen. So I try to do that sometimes. Sometimes think, oh my God, why am I in this situation? Why did I do this? But then I try to think, you know what? I'm doing this because it's a challenge for me, and inshallah I hope I get rewarded for this, but also I hope I become a better person through this, and we learn from our mistakes as well.
Definitely. And I think this month is perfect. Ramadan teaches us that if we don't actually go through the hardship, how are we going to learn?
Exactly.
And this is one of the fundamentals of Islam, when actually the fundamentals are teaching us to be patient and to fight through whatever you're feeling, for the future aim, which is essentially our aim is to get into Jannah one day, and we're all working hard towards it. And Islam is not only a religion, it's a way of life for us. So we have to use those teachings in practical life to actually get there. Because if we don't use that in practical life, then you're sort of separating your religion from life, which makes it weird.
Absolutely. So Osman, how have you, you've gone through exam season through Ramadan, you've gone through your studies. So how have you balanced it? How have you found fasting, and have you had to miss a few fasts?
No. So I fasting is something that I thought gave me more strength than it did before. So obviously when I last year I had exams, but I had just started Ramadan, so the first few fasts are normally easy anyway because your body's got enough strength. This year I felt a bit more, but it was really hard to balance studying and fasting at the same time, because I'm a guy who normally likes to nibble when I'm revising. I like to have a bit of peanuts, a bit of chocolate on the side, and have that when I'm revising. So it was quite difficult, but it was weird. Like, alhamdulillah, it didn't bother me at all. I sat down revising, and I found myself more concentrated, and actually it took away the hour and a half breaks I used to take for lunch and dinner and stuff like that. All of that went away, so I had a bit more time to revise, and it was difficult because in the beginning I thought, let me revise at night time, and I was like, it's not working out. My brain wasn't functioning. So I literally used to wake up early, revise for the whole day, and then have a nice iftar afterwards. But alhamdulillah, it's been fine. And it's clear how Allah Ta'ala says that if you actually put effort in for me, I'll reward you accordingly. And I saw that. I saw my concentration go up, and I felt more boosted, and I felt like I really wanted to revise, and actually it's been all right, surprisingly.
Oh, mashallah. Well done for going through that. It is amazing. I mean, everyone I speak to is always sometimes a bit concerned how they're going to go through Ramadan and go through their careers or their home life, family life. But when we're all going through it, Allah gives you strength, and you just manage it. So you never expect it to be as easy as it's going to be. You always expect it to be tougher sometimes, but mashallah, there's so much barakat in the month. It just flies past. At the end of it, you think, oh my God, where's the month gone?
It does, like 20 days are gone. And actually, you're right, before it came, I was dreading it. I was like, oh, I've got exams, and they're really important exams this year as well, and really hard as well. And I was like, oh, I've got exams, and I've got fasting, how am I going to do this? But actually, it's just been plain sailing, really. And now it's like 20 fasts have gone already, nearly.
Exactly.
And I've got exams next week, and once that's done, that's most of Ramadan's gone already as well. So in a way, you feel a bit sad that, I couldn't pray Tarawih as I wanted to, or I couldn't pray like I wanted to, just because I'm busy in revision and stuff. But end of the day, you have to work hard both ways to get the reward.
And it's doable. So you hear it. You've got a medical student. You got me. I'm a hospital doctor. We're managing fasts, and alhamdulillah, it's going fine. You know, I think
must be difficult doing like long shifts and all of that.
I'm a bit more fortunate now. So once reaching our consultant level, so my workload is about 9 to 5. I'd say I do one evening clinic a week, so I do finish at about 9-10 o'clock for the evening clinic. So it's because we've started doing a clinic for our teenagers. So it's obviously I'm a pediatrician and a pediatric rheumatologist, but we started doing an evening clinic for adolescents. So that's young people between the ages of kind of 13 all the way to 19, 20. Just because we felt that cohort of patients don't quite fit into a children's clinic where we've got Disney pictures toddlers running around, and neither do they fit into really an elderly
Yeah.
older patient group clinic where
Agreed.
you've got people in their 70s, 80s
Yeah.
plus, quite frail. So a lot of study has gone into this adolescent group. So outcomes are much better when they're treated as a different, unique group.
Yep.
So most of medicine is changing towards having an adolescent area,
Yep.
so which is the transition area. It's jointly looked after by pediatricians and adult physicians. So in our adolescent clinics, me and my two consultant colleagues we're the 3 pediatricians, and we've got 1 adult colleague with us as well. And we kind of decide in that clinic which patient's going to see which one of us.
Okay.
So there's still a bit, if this is probably not the right thing to say, but if they're a bit more childlike, I don't want to use the word childlike, but if it feels like they're more suitable to a pediatrician, we'll see them. But if they're quite mature and we've prepared them, then we get them to see the adult consultant, because actually the way they practice medicine is actually quite different. So and
it's because in the transition of going from a child to an adult, and then you've got rheumatology problems, it's quite a difficult phase for them as well, isn't it?
Exactly.
So in a way, it'll be good for them to have their own sort of clinic in a way.
And anyone that's got teenagers, children, who knows what we're talking about, because they've suddenly gone through a growth spurt. So it's only physiological change. It's gone through a growth spurt. They've gone through puberty, or they are going through puberty. So lots of hormonal changes. Also, they're suddenly getting more independence. So whereas they've been reliant on their parents making their decisions for them, or giving them their medication, or saying yes they can have a blood test, or no they can't have an x-ray, or whatever, now the young person is advised to make their own decisions, because you're trying to encourage them to have that independence and actually to see us on their own. So it's really I love doing that clinic. It's quite unique. It can be quite challenging. You get young people coming in, and last time I was trying to have a consultation, and the young person had headphones in their ear, and I was kind of like, should we start talking about your medication? And they were like, yeah. Do you take your medicines? Yeah. So
I was sat in a clinic once, so the patient actually had his phone out. He was Googling everything the doctor was saying.
Yeah, that's a new thing.
Yeah.
So technology and medicine. I think we should do a separate radio show on technology and medicine.
Basically, there could be a whole separate show on that.
Yeah. And the other new thing is that I think it's quite controversial, I think, but some people are recording our consultations now.
Oh yeah, I've heard about that. And they do it secretly as well, so probably they have it in the phone and stuff like that.
I know. So I recently had a patient with me. The mother was a lawyer. So that sets my guard up a bit, when you're seeing a lawyer. But she's a very nice lady. But she was recording the whole consultation.
Wow.
She said her husband wasn't present during the consultation. She wanted to share it with him. So I gave her my consent. So she actually had the courtesy to ask me, which was, I think, which I appreciated. But some parents don't ask us. So
I think we can put that out for people that if they do want to record, they should actually ask the doctor.
Yeah.
Because at the end of the day, it is a consultation, and obviously they have a right to record and stuff, but actually getting the doctor's permission, it might make everything a bit more easier and stuff like that. And some people, like for example the one you mentioned, makes sense that they want to obviously let the husband
share it with their family.
But I think asking the doctors would be nice.
Would be appropriate. And you don't want your consultation to be broadcasted on Facebook or Instagram or something.
Everything goes up on Facebook.
Yeah, because that wouldn't necessarily be appropriate, and because the sanctity of having the doctor-patient relationship is actually a very old, traditional, but very much respected sanctity. And we all in the medical profession have taken oaths to protect that sanctity and to respect and honour it. So that doctor-patient confidentiality is very sacred to all of us. Sacred. And I think if you start publicise, or if you open it, if it's done jointly for the right public audience, I think that's fine. But I think it needs to be respected and kind of contained to some extent. So it's about that.
No, definitely, I think it's really important, the patient confidentiality, and also the doctor-patient relationship as well. If, for example, you get to know that patient's been recording your conversation secretly, it makes that doctor-patient relationship, which is really important for the outcome of the patient and the adherence of the patient. If you disturb that, then obviously there's going to be problems.
So you do need trust. It's like you're people say, you're putting your hands in the life of a doctor. You are to some extent, but we're giving you the options to do that. So it's the role of, and I think also probably your experience in this, that medical practice has changed very much. Very much, It's gone from a completely paternalistic model where the doctor told you what to do, and to a very holistic model. So and now very patient-centered model.
Very patient-centered.
So that you ask the patient, you give them options. So it's about giving them informed choices so they can make their decision, and it's not making a decision for them. I think there are some examples where you do need to make a decision for a patient. And to give you an example, I think sometimes you need to tell a patient and I can give you an example. So if if a patient's deemed to be very unwell, very, very fragile, that their outcomes of a resuscitation are not going to be successful, then you can put in an order known as a do not resuscitate order for that patient, which basically means that you're not going to electrocute the patient back into life. You're not going to do some forceful life-saving techniques such as intubating and putting on life support machine, because A, their outcomes are unlikely to be successful. B, their quality of life may be much worse than it is already. And C, it might not even be in the patient's choice. If they were able to make that informed decision, it might not be in their favor, or they might not want to make that decision. So you can empower them by saying, we can put this decision in for you. And normally it happens to be that you discuss it with the family, because normally the person you're talking about is by that stage so unwell they're not able to give their consent. So you talk to the person. It's an advance directive. So in a situation like that, it might not be fair to... In each individual case is unique, because sometimes you do need the family on board, but sometimes it's not fair to say to them, what's your decision in this situation? You can say as a doctor, I would like to put this order in. How do you feel about it? So you're kind of making that decision, but also taking on their opinion.
No, I agree with that. And the whole thing about going from a paternalistic to a mutualistic approach, that's been given to us from first year as medical students. They teach that into you, that actually we're not a paternalistic approach. Obviously, at places like you mentioned, like an advanced directive, or if you're in A&E situation, you need that paternalistic way, like you have to overpower
if someone's
the patient.
hemorrhaging or someone's had a massive road traffic accident.
You're not going to wait for them and say, shall I give you a blood transfusion? Shall I fix that for you?
Exactly. Or the child's acutely sick, unwell. You're not going to say, do I have permission to give antibiotics? You have to do life-saving procedures.
Definitely. And then for most of it, they teach us there has to be a mutualistic way. It's shared decision making, and you actually give the options to the patient to make their own decisions. And actually, research has proven that patients are much likely to adhere to treatment where there's a mutualistic approach between the doctor and the patient. And I think that's really, really important. But I think that what you mentioned about advanced directive is really important, because there's a lot of stigma around it, especially in the Asian community. We don't understand what an advanced directive is. Obviously, you've been a hospital physician. Do you want to elaborate a little bit more on that, on in what circumstances would we see that, and when is it appropriate to talk about it? Because in Asian communities, you don't talk about it, because at the end of the day, you're like, we'll do everything we can to save this patient up until God takes his life, essentially.
So it's not necessarily something a patient or a family needs to even think about, because that's the doctor's role is to actually introduce that concept to you when it's appropriate, because we wouldn't expect a patient to come to the hospital and say, as a family, we've decided and sometimes they do, like for example, if it's a terminal cancer patient, they will say, we don't want this relative of ours to be resuscitated. However, on the whole, a doctor will help you make that decision. So it's not something you need to be too worried about. And if it's felt to be appropriate, so an example would be, it's difficult and to be completely politically correct about this, but it could be someone who's already got end-stage dementia. So we could someone who's no longer able to consent for any, maybe someone who's no longer coherent or what you say competent. So they can no longer make decisions for themselves because they're not able to understand the information being presented to them. So that's one thing. So someone with advanced mental stage dementia, so they can no longer make decisions for themselves. That's someone that you'd consider. Now, someone that's got multiple diseases, so someone that's in end-stage kidney failure, someone that's got severe heart disease, has already had a bypass, has already had multiple stents in their heart, so it's got end-stage cardiac disease where they can no longer have interventional cardiac surgery or bypasses or anything, so they're already at the end of their cardiac disease. Somebody that's already a diabetic, so they've lost some of their sensory pain receptors in their fingers, toes, and maybe have had some amputations. So you're talking about someone with multiple comorbidities, somebody whose mental state is no longer they're no longer independent to give their own consent, somebody who's already in a nursing home perhaps, somebody who's already bedbound perhaps, somebody who's got it's difficult to say someone's got no quality, because everyone will have some quality of life, but what would be deemed as very poor quality of life, because if you're bedbound, tube fed, with no understanding what's going on around you, and you're perhaps 100 plus, 90 plus in that situation. They're all quite extreme situations. But these are the type of, see, I'm trying to highlight is that we're not going to say a young, walking, talking, middle-aged person, let's put an advanced direction. No. So literally it is for that extreme end where we know that where we know that someone's not going to be able to be resuscitated successfully, so there's no point in their last moments of life giving them electric shocks, and there's no point jumping on their chest to do cardiac pulmonary resuscitation. So so in those situations we need an advance directive. Okay, so we're going to go on a quick break now, and when we come back we'll carry on our discussions and also talk about vaccinations. Just as a reminder, if anyone wants to call in on the studio, if you've got a medical question, if you want to ask anything about advanced directives, talk about the medical career, joining medical school, being a consultant, please do call in. Our studio number is 0333 011 6786, and we'll see you after the break.
That does not mean the reality of something, that means the appearance of something. We take the example from Quran. For example, Allah subhanahu wa ta'ala says in Surah Al-Muddathir,
we're based at 400 Cranbrook Road in Gants Hill, so come down to dine in or order in on Uber Eats or Just Eat. Amigos, hats off to great burgers. Amigos, the signature name when it comes to burgers and shakes. Our succulent burgers are prepared in front of you while you wait. Whether you go for the 6-ounce Mexican or the 10-ounce Texas.
Bro, Cuzzy's getting married and I need to get hold of a car.
Yar, I know some boys who know SPM car hire. They got the best cars in town. Rolls Royces, Ranges, Maseratis, Aston Martins. Cause you name it, they got it with the best prices in town.
Sorted! Looks like I'm going to this wedding in a Range then.
They'll drop off the car and pick you up once you're done. Just give them a ring on 01798 397 916 or visit them online spmhire.com or find them on Instagram.
Looking for meat and groceries? Look no further than Waris Food Store in Walthamstow. Visit the store to view our special Ramadan offers. 420 Hull Street, Walthamstow, E17 9AA, or for free delivery call us on 0208 521 0000. We have fresh deliveries of poultry and vegetables every day. Waris Food Store in Walthamstow.
Reliance Solicitors fight to protect your legal rights. Our firm offers a wide range of services including immigration, family law, commercial law, civil litigation, personal injury, landlord and tenant disputes and employment law. Visit us at 602A High Road, 7 Kings, Ilford, IG3 8BU, or call 0207 183 5439. Reliance Solicitors, where every client matters.
Bridgen Solicitors in Ilford, the name you can trust. We provide services in immigration, family law, landlord and tenant matters, commercial leases and civil litigation. We also deal in personal injury claim and road traffic accidents. Call us on 0203 475 4545. Visit us at 170 Cranbrook Road, Ilford, IG1 4LX.
Ramadan FM 2018,
the voice of British Muslims.
Atlantic Distributions. Whether it is frozen fish, marinated Lahori masala fish, or lamb offals, we have them available at very competitive prices. We are wholesale suppliers to restaurants, butchers and caterers. Visit us at 51 to 53 Upton Lane, London, E7 9PA. Contact us on 07415 474 185.
Usman needs the adhesive to work. If not, his day will be a disaster. So Usman, if you really need something to bond, grab a tube of CT1 from your local stockist. An incredibly powerful sealant and construction adhesive that's fast, flexible and strong. It can be used anywhere, even underwater. For more info, CT1 Limited.
Okay, assalamu alaikum. So we're back again for our medical show, the second half. So you're joined by Usman, who's a future doctor. So Dr. Usman, so nearly Dr. Usman. He's a third-year medical student that's joining us today, and myself, Dr. Nadia Rafiq, paediatrician. So we spoke about medical careers and getting into medical school and some of the lifestyle choices you have to make as a doctor. So please do call in if you've got any further questions for us regarding the medical profession. But we thought we'd talk a bit about vaccinations, as it's always quite topical, Usman.
It is, and recently it's been coming up again and again and again in the media. You see a lot on Facebook, people posting stuff about immunizations for children.
Yeah.
And I think personally immunizations are critical for children.
Yeah.
Especially in today's day and age, immunizations are really, really important, and we should be thankful for the NHS for giving us such a broad spectrum of immunizations, and I was thankful to receive them as well. But you're a pediatrician yourself, so I want to get your view on immunizations, and especially the common misconceptions that are going around.
Yeah, absolutely. So as a pediatrician, it's obviously something I feel very strongly about, and I think it's absolutely, you said critical, and I agree, and I think it's extremely important to vaccinate children, because they're vaccinated against horrible diseases, and there's a reason why these vaccines are in place, because these diseases were previously causing tremendous harm. So these diseases, if you're not protected against them, they can lead to very severe complications in not just in the childhood phase, but also later on in life. So things like polio, if you're not vaccinated against it, you can be left with severe disability. So children that were affected with polio were often had breathing problems, so they had to be the iron lungs, so they had to have special breathing machines, and often many people died because of polio. And the ones that didn't die were left with disability, so of weakness in their legs, weakness in their arms, so you're left paralyzed for life after having something like polio. So a severely debilitating disease that is completely preventable. So to me, it's beyond question that you should vaccinate against it, because that possibility is so dreadful. Of course you should prevent it.
There was that one study, wasn't it, about MMR and autism. It was quite a sad study, actually.
Yeah.
You obviously know more details about it, but we know it was one of the very few journals that was actually taken out of the journals because it was such a bad study.
Yeah.
And how
completely
that has changed
discredited
vaccines, essentially.
Yeah. So just as a reminder to everyone, approximately, I think about between 10 to 12 years ago, a very small terrible study was published in a medical journal which showed that there may have been a link between autism and the MMR, which is a measles, mumps, rubella vaccine, and that has been completely disproven. It's been discredited. That medical research has been taken out of literature. And as far in my history of being in medicine, it's the first ever time that's ever happened that a study has been taken out of literature because it had such harmful effects. And to this day, we see the knock-on effect of that. Until this day, there's this terrible myth in the community that there may be some link. So just to completely say it in black and white, there is absolutely no link between autism and the measles, mumps, rubella vaccine. That study was a very poor quality study involving a very small number of children, approximately 12 or 14 number of children, half of which already had a pre-existing neurodisability. Some already had Down syndrome, so were already at a high risk of having autism. And other neurodisabilities. So a poor quality study in a very small number of children that already had pre-existing disease. So without doubt, it's excuse me, a completely irrelevant study. It's been disproven multiple times. Since then, there's been at least 3 massive trials involving thousands of children since then that have proven absolutely no link between autism and measles, mumps, rubella.
Definitely agree with that, and I think we can see the benefits of vaccinations. For example, polio is more or less non-existent now. Apart from a few countries that still have got a few cases of polio, it's more or less non-existent now. From a place where polio was really common in the community to a place where we hardly see patients with polio, and I think that shows how great vaccinations are.
Exactly. If you look at epidemiological studies, which look at the population studies looking at the existence of people and also the incidence and prevalence of diseases, you would see that childhood survival is so much improved since the vaccination programs. So many children are living throughout childhood but also going on to adulthood because of these vaccinations. So without a doubt, they're completely the most important thing that a child needs to have one of the most important things a child needs is to be vaccinated. So we are now sometimes in hospitals seeing the outcomes of this horrible, ridiculous scare. People who are now having measles or having mumps, and Yes, it might not be a severe disease, but when when 1 in 10 children does have it, they can have a severe form of disease.
Definitely.
And need to go into hospital, need to be hospitalized, need intensive care support. And some may develop meningitis or encephalitis, so brain infection, because of these viruses, and that can lead to long-term neurodisability. So if you've got a meningitis, you can be left deaf after that.
Yeah.
You can be left paralyzed from a part of your body after that. So again, a terrible consequence of something that was completely preventable. So to me, I've never not recommended the vaccination to anyone. There's a very few group of children that are an exception, and that's children that are immunosuppressed. So if a child is on a transplant list, which means that the body's being getting ready to be transplanted, the immune system is very low. They're on certain drugs to bring down their immune system. So those people shouldn't be vaccinated because their body can't handle a vaccine. Similarly, sometimes people on chemotherapy drugs because of cancer or because of rheumatological diseases. Again, you would talk with your GP and you talk to your hospital doctors, but in those cases we advise against vaccine. But these are very extreme scenarios. And those people do rely then on herd immunity. So what the hope is that everybody else around them is vaccinated, so they won't get those diseases. Because if those young children get those diseases, it can be life-threatening. Because if you've got no immune system and you get something like chickenpox or you get rubella or you get polio, it's going to be life-threatening.
And a disease such as measles and stuff, they're quite contagious as well. So if a child does actually contract it, there is a chance other people around can get infected. But the other vaccine I think that is really important, and I'm speaking from a university perspective, is the meningitis vaccine that's being rolled out for students at universities. And I think that's really important that teenagers who are going to university actually actively take up meningitis, because the cases of meningitis at universities is increasing slowly. I think that's a really important vaccine. What do you think
absolutely. So for a vaccine to be programmed, it's gone through vigorous studies anyway. It's gone through epidemiological studies. So first you have to see whether there's any is it worthwhile vaccinating a big population of people. A lot of money goes into them, and everybody knows the NHS isn't going to put money into anything that they don't think is going to be cost effective or important. So the NHS is a resourced area. It's got minimal resources really to some extent. It's a fantastic healthcare service, and I think it's probably one of the best in the world, if not the best. We're very fortunate to have a free healthcare system, but for something to provide a free healthcare system, it means everything has to go through vigorous scientific research and has to be considered appropriate and safe and necessary, because if it's not, then you're not going to provide it for free. So the fact that there are immunizations and these programs is because they've gone through rigorous studies, and they are really important.
The other thing I want to add on this is that when it comes to going to Umrah or Hajj, we take vaccinations with our eyes closed purely because we want to go there. We never look at the side effects or anything like that, but we just want to go there. And for that reason, we take our vaccinations. And in a way, we do it to protect ourselves. But then to protect the children is really important. So the other thing people have misconceptions about is how the child feels after vaccinations. So as a pediatrician, what should a child expect to feel after a vaccination? Obviously, they have the temperature and stuff like that. But just to get the public aware that these are normal responses to a vaccination.
So within 48 hours, you can have a low-grade temperature after having a vaccine. I think that's probably the most common side effect. And a lot of children, a lot of little babies can have a bit of a temperature after a vaccine. And I think that's... we saw a massive increase in little children presented, that 2-month-old babies coming to the hospital because they've just been vaccinated a day or two after. I think it should be expected. It's no longer generically recommended to give a dose of paracetamol before the vaccine because they think it can mask an underlying... So if your child has also got a concomitant infection, you can actually mask it by giving a dose of paracetamol. However, if after the vaccine your child's got a little bit or feels a little bit warm, I'm going to be controversial and say probably it's okay to give a little bit of Calpol. However, if your child has also become lethargic, is no longer drinking milk, has developed a rash, is not behaving like they normally do, these are other warning signs that there's something else going on. So yes, absolutely, your baby needs to be checked out. You should go to the hospital. But for a little low-grade temperature and an otherwise very well baby, maybe you can give a bit of Calpol. But if it's not getting better, the temperature's not responding to that, and the child's getting worse, yes, of course you need to go to the hospital. When I was a junior doctor, we routinely gave every baby a dose of Calpol before the vaccine, an hour or two before. And then sometimes, if they, afterwards they felt a little bit irritable or a little bit of temperature, would give them a second dose. So,
just to make the child comfortable.
Yeah, so we did that routinely. It's no longer recommended to the population. I can't recommend it to the general public as a routine thing to do, but I think just to be sensible.
Yeah.
And if your child has got a serious infection, there probably will be other features as well.
Yeah. And you also wanted to speak a little bit about the chickenpox virus as well, didn't you?
Yeah, so it's not actually routinely available on the NHS, a chickenpox vaccine. It's only given in certain circumstances. So if a child, like those we spoke, the immunosuppressed children, so children on a transplant list or on chemotherapy, so their siblings, so their brothers and sisters, will be vaccinated against chickenpox, because if their brother or sister who's on a transplant list gets chickenpox, it can be life-threatening. So in that situation, you protect the family, so you protect the siblings if they've not had chickenpox. In America, it's now part of the routine immunization schedule, so every single child is protected against chickenpox. I think there is an argument to vaccinate all children. It's not considered at this moment in time cost effective. So on the NHS, a lot of doctors do feel it would have benefit to young children, but it's not been proven to be cost effective, because on the whole, chickenpox tends to be a mild illness. It's not like measles or rubella. It doesn't tend to have long-term neurological sequelae. It can have, but not on the whole. So in order to protect the one or two cases where there will be long-term severe comorbidities, there isn't a cost-effective argument to vaccinate the whole population. So literally it's a costing thing. So on that basis, I think if we were providing a completely ideal service, maybe, and if we had the resource and the money in the NHS, maybe we would vaccinate all children. You can do it privately. It is available. So if anyone feels strongly about it, you can arrange it private. And I don't think it's too much. It's probably in the region of about £20. But you need 2 vaccines, so it'll be about £40.
Yeah. So obviously that's only for children who haven't had chickenpox before, isn't it?
Yeah.
So if you've previously had chickenpox,
if you've had chickenpox, you're protected.
Yeah,
your body's already made the immune response, which is what the vaccine is trying to do.
Yeah. Okay.
Yeah. So I don't know if there's any callers out there that want to call in, but I think certainly my practice will come across people that have refused vaccines. So if you want to discuss it any further, please remember you can call us on our live number, which is 0333 011 6786. And also, whilst we're here, I think what we're very fortunate to have is that our radio show has now been given Ofcom licensing to become broadcasted on FM frequencies. So we're no longer going to be an internet radio show. We're going to be a live radio show. And it's taken a lot of time. It's taken about 3 or 4 years to put this project together. People have spent a lot of money, effort, a lot of their personal time into this. And actually what we're asking for now is some support to put the final pieces together, mostly for the equipment for the studio. The aim is to arrange £50,000 this Ramadan, and this evening there's going to be a show to try to promote that radio show and also try to gain some money. But if anyone's willing to help us with this project, we'll be very grateful. And also I think I've heard that your name is going to go on a plaque somewhere and you'll be recognized. So it'll be a huge contribution towards the community, and also inshallah towards improving the knowledge of Islam in our community, because the crux of our project will be to improve Islamic knowledge and also to support people. So I think it's a fantastic opportunity to be involved, and it will be a charitable donation. So if you are interested and would like to donate to us, our donation hotline is 07840 551 119. And we'll go on a short break and come back in about 10 minutes.
Website at pinksboutique.co.uk. Remember, that's pnksboutique.co.uk. Or pop into our store at 302 Brentwood Road, Romford, RM2 5TA.
Ramadan FM 2018.
The voice of British Muslims.
European University of Business now offering BA Business Management, MBA with specialisation. Our courses are regulated by UK Quality Assurance Agency and taught in a highly professional environment. Special offer for Ramadan FM 2018 listeners only. Please call on 0203 288 3143. Email info@universityofbusiness.eu.
Solicitors in. You can expect a variety of services from us, ranging from family law, immigration, human rights, money claims, personal injury and many more. we are committed to providing you with the best legal advice suited to your individual circumstances. Drop us a call on 0203 500 8000. Our office is located at 62 Barking Road, East Ham, E6 3BP.
Why spend summer in your room when you can fly off to your dream destination with facilities like car hire and hotel bookings? Well, Flight Masters have got you covered. We offer holiday packages, city breaks and flights at the most reasonable prices with the best provision of services. So why delay? Call us today on 0203 598 9938 or visit our website at www.flightmasters.com.
Do you dream of travelling to those blessed lands where the beloved of Allah was born? Does your heart yearn for Medina, the city of the beloved? If it is your time to experience a spiritual journey words cannot justify, then join us at Sam Travel and Tours and book your Hajj and Umrah packages today. We offer group and tailor-made packages for all your requirements. Based on Romford Road in London, for our last 10 days Umrah package, please call us on 0208 478 8911.
Ramadan FM 2018.
The voice of British Muslims.
MR Accountants provide a full range of accountancy and taxation services, including annual and management accounts, self-assessment, tax returns, VAT, bookkeeping and payroll services to all different types of businesses. With our in-house chartered accountants, you can be guaranteed to save money. Contact us now on 0203 432 9138.
कितनी बार कहा है कि घर को साफ रखा करो, मैं तो थक गई हूँ सफाई कर करके।
उफ, ये कॉकरोच, चूहे, कीड़े मकोड़े घर में घुस आए हैं। कहाँ जाऊँ, किसको बुलाऊं?
माँ, बहन, बीवी और बच्चे, किसी को भी इंसेक्ट्स नहीं लगते हैं ये अच्छे। So don't worry, I'll call City Pest Control. Deal with cockroaches, mice, rats, bed bugs, fleas, flies, all types of insects and rodents. 0203 633 0080 or 0770 279 8808. www.cpestc.com. City Pest Control, large enough to cope, small enough to care. All our technicians are British Pest Control Association qualified and we are regulated by the Royal Society of Public Health.
So assalamu alaikum everyone, welcome to the final bit of our show. So what we've covered today was careers talks. We always cover a bit of medical careers in my show, but we also spoke about vaccinations, which is very close to both of our hearts, I understand, especially me as a paediatrician, but you as well, Osman. So last section we're going to talk a bit about a bridging between vaccination, but also talking a bit about screening. So Osman, tell us, what do you understand about screening? It's going to be a Viva question to you.
So obviously screening, there's a reason why NHS has got screening. And you talked about the fact how NHS doesn't have enough money at the moment.
Yeah.
And everything they're doing at the moment is purely to prevent people from developing diseases such as breast cancer, prostate cancer, bowel cancer, cervical cancer.
Yeah.
And I think it's really, really important, especially in our community. We don't look at screening as importantly as we should.
Yeah.
Obviously
so just going to re-emphasize that point. There's actually very poor uptake of screening in the Asian community. So
not even that. There's a poor uptake of giving blood, donating blood.
Yes.
Really, really poor. Because I recently went to donate blood, and they said in your ethnic community, it's really, really low uptake of donating blood. And I think these things are important in our community right now.
Yeah, definitely. I think we'll definitely touch on the blood donation because our community need it more than a lot of other communities. So Afro-Caribbeans and Asians need a lot of blood transfusions because they have conditions such as diabetes, where they might need it. They have conditions, blood disorders such as sickle cell disease or haemophilia. So they're conditions where they might require blood products or blood transfusions.
One stat that really surprised me was 1 in 4 of us in our lifetime will need blood. 1 in 4 of us, which is quite a high statistic.
Absolutely. So I think it's an amazing thing for a Muslim to do as well. It's a charitable thing to do, to donate your blood to save another person's life. And we tend to say this a lot on our show, but actually to save one person's life is like saving the whole of mankind.
Definitely.
To kill one person is like killing the whole of mankind. So what we want to do in our deen is obviously try to save at least one person's life. And if you've donated blood and you save that one person's life, then then just
You've
think
done
about the
You've
reward.
done your reward, yeah.
There you
and
go.
actually, donating blood doesn't take long. It takes not even 5 minutes to take the amount of blood that they take. And actually, people think, oh, I'm going to get anemic and stuff like that. They only take a small amount.
Yeah.
It's quick and it's effective for the community, essentially.
Yeah, so if someone wants to donate blood, Usman, is there how did you
Yes.
find out
so,
about doing it?
if you just write NHS blood donation,
Yep.
it's all under the NHS. So they have a special clinics all around the country where you can book an appointment. In your first appointment, they go through everything, do a whole screening process. They tell you your blood type as well. And then you donate blood. And then for men, they can donate it every 3 months. Women can donate every 4 months. And actually, people think it's a massive amount, but actually it's a really small amount that can be really
How much
beneficial.
is it? Like half a pint of milk?
Yeah.
Yeah.
Yeah, probably just about that.
Just
It's
about
not even a
that.
lot. I was done within 2 minutes. 2 minutes, and they had taken all everything that they needed, and I was out.
Yeah, fantastic.
And it's quick, and yeah, I think it's amazing. I think everyone should sign up for it.
Yeah.
Especially if you're fit and healthy, it doesn't take that much. And there's so many, like in Ilford, there's 4 different places I know that take blood.
Okay, where are they?
So there's one in Seven Kings.
Okay.
One in Chadwell.
Yeah.
So they're not even far. So
Yeah.
you can easily go to the nearest one.
Yeah.
Book an appointment online. There's a massive need for it, and go and do it essentially.
Yeah, definitely. If you can do that, if we can from this show, if there's 2 people that sign up for blood donation, we've made a big difference, because seriously, people from our community, from our racial group, from Asian background, from Afro-Caribbean background are desperately needed. We need our blood is needed.
And especially they take samples for stem cells and stuff like that as well, in case there's a patient out there who does need a stem cell transplant.
Yeah.
They actually can use your information for that as well. And in our
Yeah.
community, in Asian community and Black and
Yeah.
African community,
Yeah.
there's a lack of that. And
Yeah.
actually, your donation or your stem cells could actually be beneficial for someone's life at the end of the day, especially children who've got leukemia and other disorders where they need a
Yes.
stem cell transplant.
Yes.
That could actually help their life.
Absolutely. So a massive thing to do. Okay, so final 5 minutes of our show. Just quickly, we're going to talk about screening in the NHS. So just to define what screening is. So screening is a process where you identify a disease before it has a significant effect on a person. So it's picking up diseases at a very early stage where most of them can be treated. So there's, again, guidelines in NHS, what you can screen for, what you can't screen for. But all the conditions that are screened for at the moment are because they are all treatable conditions. And if picked up early enough, will prevent someone from dying, prevent someone from having complications from that disease. So Usman, more medical questions to you, practicing for your finals. So what conditions are you aware of that we're currently screening for in the UK?
So at the moment you've got cervical screening.
Yes.
So anyone who's between the age of 25 to 50 is every 3 years. And then after 50 it's every 5 years, up until 65.
So cervical screening is just for ladies.
Yep.
So the cervix is the opening of your womb. So cervical screening is done through a smear test, which is normally done at GP practice. It can be done by a GP nurse. Some situations can be done in the hospital as well. You normally get a letter sent home. It's an uncomfortable procedure, but by no means is it a difficult or painful procedure.
Minimally invasive as well.
It's absolutely minimal. So the thing takes about 2 minutes to do. I could do it in less than a minute. So if someone's done it a lot, you can do it in less than a minute, but definitely doesn't take more than 2 minutes. 2 minutes of discomfort to pick up a cancer, which would ultimately kill you if it's not picked up early enough. It's a no-brainer not to have it done. So I think every woman should have it done.
And people don't understand what's going on. It's because the skin there is changing from one type to a different type. And sometimes you're predisposed to factors that can make that uncontrolled. And you have growths that are growing there. So in order to prevent that, you can actually pick that up early. And in case there is something going on, it can actually be treated straight away instead of it developing onto cancer.
So cervical screening, highly recommended, highly important for everyone, all women. It's crucial to have it done. And talking about, so there's also HPV vaccine, Usman.
So there's HPV vaccine. So you've got certain strains of HPV which are high risk. I hate that's 16 and 18 if I'm correct. Finally got my numbers right, but 16 and 18. And it's really important to actually get those vaccines done. And I can't remember the age at which they give actually.
13 to 14.
13 to 14 is
so teenage girls are given the vaccine at school.
And it's recently been rolled out. It hasn't been that
2
long,
or 3
actually.
years, I think.
And I think that's crucially important because what that does is it prepares the body for that virus in case the virus does actually infect.
So
and
this is the human papilloma virus, which is also the wart virus. But there is an absolute link between the wart virus and developing cervical cancer. So therefore, having the vaccine at the age of 13 or 14 against the wart virus prevents you from developing cervical cancer, and then further screening is available at, from the age of 25 onwards.
The vaccine prevents you from the wart virus and the high risk as well. So it prevents you from actually developing symptoms of the virus, and I think that's crucial to get that vaccine done and the screening done as well, because at the end of the day, nothing's 100% perfect, so you have to get the screening and the vaccine done
absolutely as well. So for ladies, there's also breast cancer screening.
So there's breast cancer screening, and it's everyone up for, what was the age again? So
50 to 70.
50 to 70. No, it's before that, isn't it?
No, ages 50 to 70.
50 to 70, and it's not even. It might be a little bit uncomfortable, but it's all it is. It's an X-ray of the breast to make sure there's no calcification or no growths, and actually it's to prevent breast cancer from actually happening in the first place. And I think that's really important, and it doesn't even take long. There's many they have like vans and stuff where they do the whole breast screening programs. It's in hospitals, it's in GPs as well. It's minimally invasive and it doesn't even take long.
And ladies, you're all recommended, I hope everyone knows this, but actually to self-palpate your breast area at least probably once every couple of months, from the age of probably from 30 onwards really. I know screening starts from the age of 50 onwards, but there's no reason why when having a shower at least a couple of months to palpate your breast area. And there's very good advice available on NHS Choices website on how to do that, because if you feel a lump in your breast area, it needs to be seen. Get it checked early before it spreads or before it changes, and most likely it's going to be benign, so it's going to be a non-cancerous lump, but you'd rather have it checked and have that completely ruled out before leaving it and it becoming a genuine cancerous condition.
And these things are easily ignored in our community. Self-examination, especially for men and women, are really important. Men have to self-examine the testicles, I'd say once a month, just to make sure that nothing's going on. Same with women as well. But self-examination, I think, is crucial right now.
It's anything you can do to prevent disease, that's what screening is all about. So breast cancer screening was spoken about, cervical cancer screening was spoken about, but also for men there's prostate cancer screening and also bowel cancer screening. So
bowel cancer is available for men and women, and what they do, they send you a home test kit actually. If you're over 60. It's done every 2 years. You basically take some samples of your stool sample and you send it off, and they can measure that and actually send it back if there is any abnormalities. But it's routine and it's good because it's really good to get it checked. And it's every 2 years. It's not even invasive or anything like that. And the other one that is the prostate one. So the prostate, there's a blood test for men. Where they check for the prostate-specific antigen.
So the prostate is a gland, which is only in men, not in women, and it's in their genital area.
That's correct.
So it's a test, and it's an area which can develop cancer. So therefore, there is a blood test available for men to prevent you from developing complications. Because you're not preventing the disease. If it's in your body, it's going to show itself.
You're stopping it from getting worse.
Absolutely. You're picking it up at the early stage where something can be done about it. So there are cures for cancer, and there are cures for breast cancer, cervical cancer, and prostate cancer, bowel cancer. They're picked up early enough. And what this screening is trying to do is pick it up early and deal with it before it becomes a life-threatening condition.
That's the biggest thing about this, is picking it up early and trying to get it treated before it actually gets worse. And I think that's crucial, especially in our community. We really need to take these messages on board and actually go ahead with them and actually do all our screenings, do all our vaccinations, and hopefully, inshallah, pray as well. And Allah Ta'ala is the one who gives us health. Absolutely. And He always tests us as well. If He doesn't test you, clearly you're not doing something right at the end of the day. And actually, illnesses is part of the test from Allah as to how you deal with illnesses. But I hope that may Allah keep everyone healthy. But if someone does have any problems, we are around. And if anyone does have questions, we're always available.
Yeah, definitely, Armin. So thank you to everyone who's been listening to our show. We've come to the end now. Thank you very much to Usman, who was a delight to be on my show today. So inshallah, I'll be back next Sunday between 1 to 2 p.m. And I'm very much looking forward to my show next week because inshallah, I've got a lady doctor with me who is a non-medical doctor, but an alternative medicine doctor. So maybe a bit of a controversial show. I have my own views about that, but we'll be sharing that with you next week, inshallah. So
that'll be an interesting one. I hope everyone tunes into that one.
Yeah, that'd be fantastic. Okay, so we wish you all to a very successful Ramadan for the remaining few days, and inshallah good health to all of you. Assalamu alaikum.